We're here at the IAS meeting in Vancouver with Nicholas Chomont, who is with the University of Montreal and formerly in Florida, and we talked about you moving north, which you like because it's in the same latitude as France.
Absolutely.
So that's kind of nice.
Much colder than Florida, though. But
yes, but you have been working so arduously in the field of cure research, and I think there's a couple things you want to touch on today of things that you're doing, and also what are happening at the conference.
Sure. So the first thing I'd like to talk about is the importance of early treatment in HIV infection. So we have more and more evidence that it's not only good for the health of the patients, like people who start out early on usually show better reconstitution of their CD4 T cells. Also, they transmit less the virus, which I think is important, but also from a reservoir perspective, so a cure perspective, early treatment is also good. That's actually a work we've been doing in collaboration with the Military HIV Research Program in the US and with the Thai Red Cross in Bangkok, in which Jintanat and Anvaronich, who is the PI on that study, recruited and enrolled participants who were very acutely infected with HIV. And
so when you say acute, that means like within days or hours?
Within
days?
weeks.
Within weeks,
yeah,
okay.
Within the first 2 weeks.
Because I know that the virus, we talked about this as maybe being 3 days as being possible PEP territory.
Yep.
But after that, it's more or less just trying to keep the viral set point down. And can you address how that might be helpful?
Yeah, so that's a very different strategy than PEP, because PEP is given to prevent the actual infection.
Yeah, right.
And what we're doing in Bangkok is that the patients are already infected, so the virus is detectable in their blood.
And they didn't catch it quickly enough. Yeah.
Exactly, and then you put them on ART, on antiretroviral therapy, and the virus comes down very quickly. And the reservoir is actually very small in these participants. And the fact that the reservoir is small is important for cure research because we believe that it's going to be easier to eradicate or control the viral reservoir when its magnitude is smaller. So I think that's the first thing that we should probably try to push is the importance of early ART. And even if it's not within the next 72 hours after infection, there is still a benefit of treating early.
So let's use this as a promotion moment, because I think a lot of people don't understand that there is a moment where when you're infected acutely, there is usually a viral spike, a huge viral spike. Millions of viruses are in your body. So you get the flu syndrome. Does that always happen?
That does not always happen, actually.
So don't always count on it. But if it does, and it's not a time when the flu is prevalent, that it could be, and that would be immediately get to the doctor, do a viral load test, I guess, or whatever test you can find out to see if you're infected. Because if you are, this is the now opportunity to be in a better position, not only for your health overall, but to be a better candidate for cure down the line.
That's exactly the point.
So let's say this is maybe a really great pitch for not only a sense of if you're infected, but maybe for prevention, and also for people just that are afraid to get tested. The more you can test, the more quickly you'll learn if you're positive.
Absolutely.
And so it is of some serious relevance to know as early as possible.
Exactly, and I think that's really important, and something that we probably did not stress out enough in the past is that even if you're getting infected, still it's important to get diagnosed immediately so you can start.
Don't go into denial.
That's my point.
Be in the real world. Realize that this is an opportunity for you as a person to take that opportunity and to utilize it as an advantage to do better with the disease.
You're absolutely right. That's the point. So in addition to early antiretroviral therapy, which I think is key, I think we're getting more and more evidence that if you want to get a cure, trying to reach out the virus will probably not be enough. So we have to do more than just trying to eliminate the reservoir. This reservoir is disseminated pretty much everywhere in the body.
Every single cell and so forth, yeah.
In the blood, in the liver.
When we talk about compartments, it's not like here or there. It's like as an organ in the body, it's like in that whole organ.
You're absolutely right. So I would love to be able to tell you that we're going to get a sterilizing cure tomorrow that will be able to get rid of every single trace of virus. I think it's going to be difficult to achieve. I'm not saying it's impossible. I think we just don't know yet, and we still have to do lots of experiments in test tubes and also in animal models to determine whether or not this is feasible. But I would say my strategy would probably be to combine something that would reduce the size of the reservoir with something that would boost the immune system to be able to control it. So
it's going to be a combination of one modality and another modality, maybe a triple modality. I mean,
absolutely.
it seems it's always been that way, and no matter what you're talking about, whether it's even hepatitis.
Yeah, exactly. That's the point. And I think this component, this immune component, has been largely ignored for the past 10 years. We were all looking for a sterilizing cure that would eradicate all traces of virus. I think
unrealistic. Maybe.
Well, I won't
Maybe.
say that, but much
Maybe.
more difficult.
Maybe, yeah.
I think this immune component is really essential, and we have to work more on this. And there are different strategies that are being developed right now. So some of them have been tested in the monkey models and show some promises. So there are single molecules that can do two things at the same time. They can reactivate the virus from the latent reservoir, which is something you want, and at the same time they can boost immune functions. So these are the ideal molecules that you want to test. TLR7, which is a study by Jim Whitney and Gilead, has been administered to monkeys and shows that yes, you reactivate the virus and the immune response is getting higher. And we have other candidate molecules that we are working on in the lab, which are called immune checkpoint blockers. So these are basically antibodies that are given to cancer patients. And the idea of these antibodies is to restore the immune system in those cancer patients, and it works pretty well. And in people who are HIV infected on suppressive therapy, we actually found that these antibodies would not only restore the immune function, which is good, but they would also target the reservoir cells. So again, you would get both effects with a single molecule. So that's what we're working on now. We, at this stage, I think we have compelling evidence in vitro that this might work. So the next step, obviously, are the non-human primates, and hopefully we will be able to put it in people pretty soon. But that's something.
There's not too much. Or is there any side effects that you can?
So it depends on the antibody you will use. So immune checkpoints, there are different classes or families, I would say. The one we're working on mainly is called PD-1, which is one of important molecule of this family, but there are others like CTLA-4, TIGIT, BTLA, and other that might work. And the side effects associated with the antibodies differ between these different molecules. For instance, the anti-PD-1 that we are working on shows very little side effects usually, so that's what we think it's a promising approach.
Are there modifications you make to those molecules, or is there a second generation of molecules that could be modified in a way?
I think we will be able to modify them, and more importantly, again, as you said just before, I think combination is going to be key. So one single molecule might not be enough, and we might have to actually administer more than one molecule. Pretty much like we did with triple therapy. 10 years ago, when triple therapy was actually announced here in Vancouver, that really changed the world.
And we're back here again with
Yes.
with more exciting news.
Absolutely.
Yeah.
Absolutely. So we'll see, but again, we are at the very early stage of this therapy with immune modulators, but I think they are very promising.
Well, I'm excited that you're here and doing the work, and found a comfortable home in Montreal, Canada.
Thank you.
Thank you very much, Nicholas.
Thanks very much.
Yeah.